Hello and welcome. Again, Dr. Sanjay Shah. Today we want to explain what happens with obesity and back pain. Does obesity actually make a difference with low back pain? Over here you can see an individual that's obese, and here an individual that's obviously very slim and trim. The biggest thing with obesity, as you guys know, is you have this big pannus in the front that carries a lot of weight. You can see this individual's would be kind of brought down, brought forward if he didn't have muscles in the back that were really working hard to support him. So he's using a lot of his muscles in the back, in his spine, therefore putting a lot of pressure on the lumbar spine. Most likely this individual doesn't have that much core strength. Core strength are the muscles that are within your abdominal region. People always focus and say, hey, core strengthening is awesome to prevent low back pain. Anytime you go to a physical therapist, they're always going to say, focus on your core if you have low back pain and it'll help. I'm going to show you how with an example. I'm going to use a suitcase. So this is this nice skinny guy. This is the obese gentleman. Now, the handles on the suitcase actually represent the spine. It's a good depiction of the spine. With this individual who's obese, what we're going to do is put a little weight on the front. Now, when we do that, what's going to happen? It's going to fall forward. So imagine all day long, this guy is not falling forward just because he has equilibrium, but imagine the amount of stress that's going on his spine that's creating a lot of low back pain. So now we say, okay, fine. We've got an obese individual, but let's give him some core strength. So what I'm going to do is inside, we're going to strengthen his muscles. We're going to give him the abdominal strength of Hercules. Look at this. This is the difference that it makes. This individual is now stable because he did strengthen his core, even though he has quite a big abdomen. Imagine this guy. He has no abdominal, he has very little obesity, but if he had also core strength, his lumbar spine is now extremely strong. Just to give you an idea of what this looks like, this is Billy. If you look at Billy's spine, if you're leaning back, the joints of the spine have a lot of stress. The muscles of the spine can also suffer a lot of stress, and this can lead to low back pain. This can lead to these joints over here, the facet joints, becoming arthritic. They can swell up, they can press on these nerves. That can also lead to sciatica, radiculopathy. That's where you have pain not only in your back, but the pain can also go down the legs. It can also lead to a lot of instability of the spine. When this patient leans back constantly, all the stress on this spine can make these ligaments very loose. By making the ligaments loose, you're creating a lot of instability of the spine, which can lead to problems down the road. So, really the whole goal over here is how to lose the weight, and it's very hard. It's easier said than done to lose weight, but even if you can focus on core strengthening exercises, even if you are obese, you can probably afford yourself some stability and decrease your low back pain. Physical therapy is really a must. Thanks a lot.